I'm speaking today to Trent with the Dubious Affair. He's affiliated with Dubious Affair, but Trent, can you explain the ownership of the business?
Yeah, Mare is the owner. I basically am an employee of hers. So.
Okay, thank you. When we were talking this morning, you mentioned a few things about the business. You're based here in the Gallatin Valley. You've been open about how long?
2 months.
2 months. And you said you had, as I recall, approximately 30 patients in your...
I believe so.
Yeah, okay. And has that seemed to be a pretty manageable number?
Yeah, it's
to know your patient needs and to be able to or know their circumstances and to be able to take care of their needs?
Yeah, it's definitely a reasonable number. I think when you get too big, sometimes it gets a little out of control and quality goes down, and your care and focus on your patients goes down. So.
Sure.
So that's why I think it's good for to have a lot of caregivers out there and to keep them all small businesses. So.
Okay. And that probably ties into a little bit of your political philosophy, as you told me, which sort of ironic. People may not think of it in these terms, but the current situation maybe wasn't created, but it was given impetus last September when the Obama administration decided not to enforce federal marijuana laws in those states where medical marijuana was legal. You mentioned that you are not necessarily a supporter of the administration.
I'm definitely not an Obama supporter. I'm a constitutionalist libertarian, so I believe in freedom and limited government, and also I don't believe in the police state, which both political parties believe in. If you can't tell, they both support the Patriot Act and things that I believe are violating people's constitutional rights. So no, I don't subscribe to the administration's views. I thank them for making the decision they did on this, but.
Okay, and lastly, you described for me that that based on your clientele and perhaps what you know from other caregivers that you network with, that there's quite a diversity of at least in terms of age and background of people who seek relief through medical marijuana. Could you describe that a bit, please?
That's right. I believe the average age is in the middle 40s. I believe we were talking about that earlier. I'm not sure the exact age, but it's in the mid 40s somewhere. I think that a lot of it is because a lot of them have been taking pain medications for a long time and have been addicted to them, or have liver and kidney problems because of the medications they're taking, and they're looking for a natural resource that they can go to counter the pain without destroying their kidneys or liver any further. It's also proven that it's not physically addictive. It could be mentally addictive like anything else. Candy bars can be mentally addictive, But, Oxycontins and the other pharmaceutical drugs that you would take for pain are extremely addictive. You can overdose and die from it. So, I think people that are concerned about their children should be very concerned about the drugs that are in their, cabinet, because that is much more dangerous than marijuana. And I agree, young kids should not be anywhere near it, but at the same time, we need to recognize that, all drugs are dangerous. And marijuana you actually can't even overdose on, and a lot of people don't realize that it isn't a serious drug like cocaine or methamphetamine. So.
Mm-hmm. Okay, and you also said that the walks of life that people come from, they kind of are a slice of Montana.
Yeah, that's right. There's people that you would never expect being here. I've seen women in their early 80s, coming in and getting their cards, and seeing people of all walks of life that you would never picture coming to an event like this. So,
okay.
It's nice. It's nice to see people realize that there is an alternative to pharmaceutical drugs. So.
Well, Trent, again, thank you for your time, and have a good day.